Hi guys, my name is Heather Grimaldi. I'm a board certified behavior analyst. I owned an ABA company and I just wanted to pop on here and be able to offer my support. Right now it's a little crazy and hectic and everyone's new norm. And so I just want to be able to jump on here and talk to you guys about tips that have been working in my household for families and for families in general, because as of right now, parents aren't getting, our kiddos aren't getting their ABA programs. It's hard. There's not so much consistency. It's a little bit crazy right now. So I am going to see, I'd love to see any questions that people might have. We do have some questions beforehand. I see a Candy Aguilar. Do you have any questions? Just wanted to, like I said, be able to offer support as a BCBA. A lot of families aren't getting ABA services, or the services that they are getting are very limited. So they're via Zoom and via Skype sessions, and that can be a little bit difficult. So I'll see if I get any questions real quick. Of course, Lorenda. I love just being able to help. So a little bit more about me. I owned an ABA company. I sold in 2016 to Autism Learning Partners, which was one of the largest ABA companies out there, to create one of the largest platforms. I'm a firm believer in ABA. I think that it's so important, consistency and structure. I also got very into the new world of nutrition, having a daughter that had sensory processing disorder and cyclic vomiting syndrome. And then I started another company, Simple Spectrum. So I'm just real big about helping families. I'm an ambassador for TACA, the Autism Community in Action, and just like helping families. Oh, I love all these. Thanks for helping out. Hi. So if there are any questions you specifically have right now, so the one thing that I like to talk to about parents right now with this new norm is consistency, and anything that we can do for consistency. And everyone's doing these distance learning or Skype ABA sessions, not always easy. I like to incorporate things. I actually made one for my daughter, a token board. Token boards are really great. That, reinforcement and things that you can make to help with your child. For here, I put my daughter's June's Power Minutes, and maybe they get 3 of these and then they get access to something. Those are real big. I'm also going to be answering questions as I'm talking to. Is there any services for adults? Oh, absolutely. ABA is great for adults. I'm really big about, I think social skills classes are super important. Unfortunately, right now, a lot of people don't have ABA, or their ABA has been sent to telehealth. So it's a little bit more difficult. It takes a lot more work from the parents, and, it's all about them following through at this point. Do you help our kiddos with this new normal for ABA? I do. I like doing a lot of stuff like this, lives, and teaching families things that they can be doing, at home, because, I've been seeing a lot of memes lately about our kiddos, and, it's hard for them, and they're, congrats to them for dealing with this so well and being thrown into this, this new norm, and talking about visual schedules and teaching our parents how to do visual schedules. Every morning with my daughters, I like to, just take a blank sheet of white paper and write out a daily routine of what we're doing. Kids work so well with a visual schedule and knowing what to expect next. When it could be very simple things, easy things like starting with breakfast and then brushing teeth and adding preferred and non-preferred tasks on there. But just in general, kids work really well with that. I work well with that when I know what to expect and things aren't thrown on me. But it's just so important for our kiddos, that with autism as well, and with the lack of structure right now. So, putting together a little visual schedule that you guys can do together, paired with a token board and some reinforcement. I also love doing social stories. Once again, kids are great visual learners when they know what's to expect next, and writing out, just taking a few pieces of white paper and having your kids involved in that shared control where they can write a little story about, heaven forbid you do have to go to the doctor right now or dentist right now or go to the store, and how they should be behaving and what they should be doing and what they could be expecting, because it's a little bit scary. I actually we're not getting out much right now. I'm in California where it's pretty locked down, and my kids asked if they can go to the gas station with me, and we went, and they saw people wearing masks and like full suits, hazmat looking suits, and were very confused and scared by that, and writing even visual schedules so they know what to expect and what, like what's going on, and understand a little bit more. Yeah, token boards, they're great. I love them. And I think it really helps. Definitely. Another thing that I really like to do with my daughters, I notice right now a lot of inappropriate attention seeking. Yes, I might be home a lot more because I'm trying to work from home more because that's what we're supposed to be doing. But I'm not giving my kids as much attention, or it's not the right attention, or it's not my full attention because I'm doing 500 other things. So I try and do what we call in the BCBA world, in ABA terminology, NCR, non-contingent reinforcement, where both of my girls, even just for 10 or 15 minutes, I have my undivided attention on them at the end of the day, where we're playing a board game, we're coloring together, we're doing something like that together where they really have my attention. I think it really helps with the inappropriate attention seeking, because right now I'm getting a lot of that. I think a lot of people think because I'm a BCBA, I have these perfectly behaved kids. I do not. I actually just did a live the other day, and one of my kids running in the room. It's crazy. We're all adapting to this new norm. The distance learning, so difficult right now, difficult for everybody. And anything that I can do to help, or tips that I can give families, and I feel like that work in general for our kiddos and are working for my own kiddos, I think is so important. Anyone else have any other questions about, their own program, what that they're doing, or that's doing distance learning themselves, or, how sessions have been working for them, if they are doing Skype sessions, or maybe they are still doing ABA sessions. Okay. As an adult on the spectrum who grew up without a diagnosis, I'm finding it interesting learning what exactly ABA is and exactly how it works. Yes, ABA can be amazing. I do believe that sometimes it gets a bad rap as being known as robotic, but I think that it's amazing when done correctly. It's all about using a child or adult, just using reinforcement. Actually, I used my own husband when I was doing my thesis for my BCBA and for my master's stuff, and it was about, is verbal praise reinforcing enough to get him to make his bed or make the bed, little things like that, and little stuff that we did. Verbal praise, we all go off of verbal praise and reinforcement. We go to work every day, so we get a paycheck. I just believe ABA is so great when done correctly, all about using a child's motivation and teaching social skills. And, I don't want a kiddo to know that they're working. We're outside and we're playing with bubbles and having so much fun, but working on eye contact, response to name, getting that sensory input, reciprocal conversation. And it just, it's very natural, pivotal response training, as we call it. Not just a DTT, discrete trial training, sitting at a table, but making it fun and natural. Yeah, I think we're all getting a lot of the inappropriate attention seeking. So if you can try and set apart 10 minutes, just alone time with them, it really makes a big difference. I've noticed such a big difference with my kiddos. So what if you have an almost 3-year-old that's delayed and he doesn't pay attention to you? Wonder if there's, to you or anyone trying to teach him only things to get his attention. That's it. Um, so that can be a little bit difficult. Are you trying to work on getting his attention and getting him? That's actually one of the things that being a BCBA, we really work on gaining attention appropriately and sitting and being able to attend. That is, a skill that does take some time. So, trying to find something that is fun and having that shared control and playing with them and doing something that they might like as well. I love this. We absolutely love our ABA and have an ABA since my son was 4 and he's 9. He's doing video chat now and isn't liking it much as the one-on-one. Yeah, that's where it's so difficult. I really wonder how it's kind of happening right now, because I feel like it's very hard to get a child to engage and sit that long, especially for some of our kiddos that are getting pretty intensive ABA programs. There's kiddos that get 40 hours of ABA. So honestly, it's really on the parents right now, and doing as good as you can to follow through on some of the goals that they might have, and understanding that we're all in this together, and we know that you're doing as best as you can and whatever you can do. And picking a few different goals and talking to your BCBA about how they really want you to be able to follow through. What I like to say to parents, 2 most important things that I like to remember is no means no. So if you say no to something, follow through, and following through on it too. Because I know me just as a parent, once again, yesterday, even being a BCBA, I think everyone thinks that I'm supposed to have this perfectly behaved child, but I was on the phone, my child wanted something, she was crying, wanting it, I said no, but I needed to finish this call, and then I gave it to her. Unfortunately, I just reinforced the behavior. And so even just being aware of things a little bit more, and that you're not inadvertently reinforcing behaviors, because it's gonna happen. It's gonna happen right now because we're all thrown into this chaos. So my child, I have 2 children. I have a 3 and a 7-year-old. My 7-year-old has sensory processing disorder, and we're teetering on the diagnosis of ADHD. She was in early intervention ABA. I believe ABA is great for anyone. I just think it's so amazing. My other child that's 3 has cyclic vomiting syndrome and sensory processing disorder. Let's see. I was wondering, have you seen parents go from having their children in school to homeschooling with ABA? I have. I do have, especially for some of our early intervention kiddos that have started in school and then decided, hey, they wanted more intensive ABA, that they were very young and decided to do more intensive ABA, and that was working really well for them, because they started them in like a preschool setting a little bit soon, and they felt like ABA was really working great for them. I also am a big fan of ABA in the school system and helping with social skills. I feel like it gives a child that little extra support, maybe when they're on the playground, and gaining attention appropriately with peers, and when they are given that free time because the teacher's not with them, to make the right decisions and helping and giving those prompts and that kind of stuff. I think that that's great. Any other questions? Awesome, Christina. Anyone else have any other things that they've been encountering that have been especially difficult for them right now? You're welcome. I just think it's, once again, really important to remember that this is everyone's new normal right now, and this isn't going to be long term, and don't be too hard on yourself. Let's see. My son, how can parents help their kids with dealing tantrums? Tantruming is a little bit more difficult. You're definitely probably going to see a lot more behaviors because your ABA therapist isn't present and they're helping you work through some of those things. I'm really big about coping strategies and teaching your child coping strategies and deep breathing techniques, counting. I'm big on that as well. Different proactive teaching strategies that you can teach. This is why we're so important, and I firmly believe in like visual schedules, because I think it helps with tantruming and your child knowing what to expect and that shared control. It really helps with tantruming. So our goal is to do things to prevent it from happening. So proactive teaching strategies, very big about that. Exactly. Concrete rules, knowing what to expect. I also love with my kiddos, sensory breaks are really important. I think it really helps when your child's getting overwhelmed. And, you know, I love that, you know, that sensory input I think is so important as well. How do I get my 12-year-old to use a mask? That is a great question. This is where actually I'm a firm believer in social stories. I think a social story could be great, and having them, you can try and write a story and pictures and showing them about a child wearing them and why we're wearing it and the reasons we're doing it. So yeah, I think that that's so important. Pictures. You know, you can do either. Pictures, there's some different stuff you can find with Google Images and different images like that. I like having, like, you know, even just draw pictures with the kiddos and having them involved. I think that that's really important, and having the families see that as well. Yeah, I really think that those can really help. I'm also, you know, we're seeing a lot of tantrums in our house as well. Another thing that is really important, proactive teaching strategy as well, timers and giving reminders. You know, you got a 5-minute timer, 5 more minutes of the iPad. You have, and just giving reminders. Me as an adult, when my husband springs on me, they're like, hey, we're leaving right now to go meet my friends, and we're going, you know, to go to dinner. I freak out, you know, a child on the spectrum. Any child is going to do that as well. So remembering things that work for us as well. I need that extra time, giving our kids those extra time. So things that we can do proactively to help with these things as well. Especially since right now, everyone's routine is just so thrown off. Let's see. Anyone's. Don't think that there's any other questions. I'm going to wrap up if there's any other questions. So I guess once again, I'm a BCBA. I'm a firm believer about ABA, early intervention. I think that it's so important, and any of these things that you can be doing, especially right now. I also think right now, with our kids being inside, sensory breaks, all that kind of stuff, and you know, getting outside, whether it's just going in your backyard and doing some sensory activities and getting that our kiddos those sensory inputs, so important. And also looking at nutrition. I became so passionate about nutrition and supplementation. I'm a BCBA, and I was kind of thrown into it. I used to be a professional. Well, I'm a professional as well, but now here I am as a parent that became more passionate than about nutrition as well, and looking at diets. And I actually now became involved with my partner, Dr. Kristen Shea, and we created a supplement, Simple Spectrum supplement, and looking at nutrients and nutritional deficits. I was actually very involved in 2013, getting SB 946 to reimburse for ABA, and we were one of the first ABA companies to reimburse for ABA. We're the first actually with Medi-Cal, which was so big and so important. I'm just a firm believer in ABA, and now here I am actually with a supplement. I'm a firm believer in supplementation. There's a lot of studies linking vitamin B deficiency to speech delays and stuff like that, and putting a better nutraceutical out there, because there's a lot of research. Dr. James Adams did some amazing research linking vitamin B deficiencies, and just a lot of different research out there. So we created a supplement based on those with nutrient deficits and our super picky eaters with sensory delays. So I'm just a firm believer in looking at the big picture, and especially right now, getting good nutrition as well. So I think that all that's really important. So if you want to check that out too, Simple Spectrum supplement, just for supplementation right now, because that's really important as well. So it is called Simple Spectrum Supplement. Maybe we can put a link later, or even do some type of giveaway. We could send out to a few people that comment and would love to try it just for free. It is a nutraceutical. So actually, a little bit more about my story. I'm an ambassador for TACA, the Autism Community in Action. I started one of the largest ABA companies in California and sold to the largest in the world, Autism Learning Partners. But I became so passionate about supplementation as well, because I couldn't get in. Even with all my experience in being in this autism world, it was really hard for me to get into a biomedical doctor's office. And I finally got into a biomedical doctor's office, and I came home from the doctor's office with 10 different supplements. My child has cyclic vomiting syndrome, and I couldn't even get her to take those supplements, and it wasn't realistic. So we really created an all-in-one doctor grade, nutraceutical grade that you can purchase. Not just, we mainly sell to MAPS doctors, Medical Association Pediatric Special Needs doctors, but you can also find on our website as well, and just more accessible and affordable. So, sorry, Autism Vanessa, if you can re-ask that one. I didn't see that one. You said Heather, I don't think she can. Heather, are you seeing what I'm posting from the watch party? I can't. Okay, so my college testing, I understand black and white testing versus seeing the test. I would definitely see about extra support. They should definitely be giving some extra support for those. I think that is really important, especially in the college setting. And things like IEPs, and any extra support is great. How much do you deal with the situation? I'm not sure what exactly that means, but yeah, I think in general, this is everyone's new norm. It's a little bit crazy right now. I'm just trying to deal as best as I can and do as much as that I can. I do a lot of toilet training tips for families as a BCBA, and I was really big about teaching social skills classes. That's what my ABA company was known for. So I'd love anything that I can do as well to help. Of course. Well, I love it. Thank you for all these amazing questions. Like I said, I just love being able to help and educate families and support families. I'm, like I said, a firm believer on early intervention, and I love ABA. I think it's so great. Oh yes, my kid's so picky. I see that my kid's so picky, and there's so many supplements. That's the thing. One of the times I came home from CHOC after being in the ER with my daughter because of her picky eating, and I had 10 different supplements I'm supposed to give her. So we were all about creating an all-in-one unflavored dissolvable powder, because it's not realistic to give your child 10 different supplements. I can't do it. I teach food programs, and it was very difficult for me as well. So. I think that's all I got for today. I love all these amazing questions. And if anyone wants to post questions later or direct message me, they can direct message me. Even if they want to direct to Simple Spectrum Supplement, or we have a live chat on our website. If they have any questions about that, any ABA questions in general, you can write us on Simple Spectrum, and they can get those to me as well, because I love just being able to support families. So. That's basically all I have for today, unless anyone else has any questions. think that's good. Am I off? Of course, of course. Thanks, Lorenda. Awesome, Courtney. I can keep answering questions. I don't know if I'm still live on here. Um, you know, I think all ABA is great because once again, it's dealing with the principles of reinforcement. I do think some people might not be doing it the right way. So it's all about establishing yourself as a reinforcer and having the best ABA and having fun and using a child's motivation and not seeming like it's sit in front, DTT, do this, do that, very robotic. Have fun and use your child's motivation. I think it's great for anyone. Well, it was a pleasure speaking with everyone.